Good evening, everyone, and thank you for joining us this afternoon for our coronavirus media briefing. We are joined this afternoon by the Minister of Health, the Honorable Kim Wilson. We're joined by the Chief Medical Officer, Dr. Ayo, and by Dr. Wesley Miller, the Chief of Staff of the Hospital School. We'll start our press conference with remarks from the Minister of Health. Go ahead, Minister. Thank you.
Thank you, and good afternoon, everyone. Over the past few weeks, our COVID statistics have improved. Although we have reported coronavirus-related deaths, we have also seen fewer active cases. While we cannot become complacent, I am optimistic that things will continue to get better. And for things to continue to get better, we must all do our part and follow the public health guidance. As we move on and learn how to live with COVID-19 in our midst, our technical updates will be less frequent. I envision holding briefings only when we have more information than a press release can appropriately provide and when we have important announcements. We have completed week 42 of our vaccination program, and since January 11th, Bermuda has administered a total of 95,829 vaccinations. And of that 95,829 vaccinations given as of October 30th, 52% are women and 48% are men. 86% of all residents over the age of 65 have had at least one vaccination, and 84.5% are fully immunized. To date, 70.6% of the population has been vaccinated with one dose, and 69% of the population has been immunized with 2 doses. From January 11th, 2021, when Bermuda's vaccine campaign began, to Epi Week 43 ending on the 30th of October, 2021, Bermuda's COVID-19 hospitalizations and deaths of vaccinated and unvaccinated persons are as follows. Hospitalizations, which includes repeat admissions, totaled 303, of which 269 or 89% were persons who were not fully vaccinated, and 34 or 11% were fully vaccinated. To October 30th, Bermuda has also sadly had 91 deaths, of which 78 or 86% were not fully vaccinated, and 13 or 14% were fully vaccinated. As I have said on many occasions, the COVID-19 vaccine remains our best defense in preventing the spread of this virus. It will decrease symptoms and severe illness, and in most cases, prevent death. I encourage everyone who has questions about the COVID-19 vaccine to please talk to their doctor. If you want to be vaccinated, please register your interest as soon as possible on gov.bm/vaccines. There are many opportunities and locations to get your first and second dose and boosters for those who are eligible. One of the issues we are seeing is people not showing up for their second dose appointment. If you have scheduled to receive your second dose, please do not miss your appointment. If you need to change your appointment, or if you have concerns or simply afraid, call the vaccine hotline at 444-2498, selecting option 2, or email vaccines@gov.bm as soon as you can so that we can assist with any concerns that you may have, as well as to reschedule your appointment. Those who have decided to get vaccinated can book appointments or walk into the KEMH Vaccination Clinic on Tuesdays and Thursdays between 4 p.m. and 7 p.m., and on Saturdays between 8 a.m. and 4 p.m. And again, medical doctors will be at KEMH on site to answer any questions that you may have concerning the COVID-19 vaccines. COVID-19 vaccinations are also available at our Hamilton Health Center at 67 Victoria Street every Tuesday between 2 p.m. and 4 p.m. And these vaccinations are by appointment only and no walk-ins are accepted. You can get your first, second, and third dose there as well. And you can call 332-8906 for assistance in scheduling an appointment, or you can book online at www.gov.bm/vaccines. I will now provide an update on the expansion of our booster program. During the months of November and December, the KEMH booster clinics will be held on Wednesdays between 8 a.m. and 8 p.m. and on Sundays also between 8 a.m. and 8 p.m. by appointment only, and there'll be no walk-ins. The last booster clinic at KEMH will be on the 22nd of December. Currently, booster vaccines are available for healthcare workers and essential and critical service workers who have had their second dose at least 6 months ago. For an avoidance of doubt, essential and critical workers include hospital staff, healthcare workers, police officers, fire service, Bermuda Regiment, prison officers, utility workers, which includes electricity, communications, and water, stevedores, and other essentials such as teachers. From tomorrow, the Thursday, the 4th of November, the booster program will move to the next level of service. The program will expand to all 50-year-olds and older, as well as all those with chronic conditions between the ages of 12 and 49. And these conditions include the following: active treatment for cancer, chronic kidney disease, chronic lung disease, chronic neurological diseases, including dementia, diabetes, both type 1 and type 2, serious congenital diseases, including Down syndrome, sickle cell disease, and thalassemia, chronic cardiovascular diseases, including heart failure, coronary heart disease, cardiomyopathies, and hypertension, and other immune-compromising conditions, chronic liver disease, overweight or obesity, chronic cerebrovascular disease, including strokes, substance abuse disorders, as well as homeless persons. Pregnant women who have had second dose at least 6 months prior can also make an appointment for a booster. Additionally, those 65 and older who have had their second dose over 6 months ago can also go to the walk-in at Pier 6 between 10 a.m. and 5 p.m. to get their booster shot this week between Monday and Friday. The expansion of our program ensures all those that are eligible for a booster can now make an appointment for the booster shot. To book an appointment for a booster vaccine, please visit the government website link, gov.bm, and select Book a Booster Vaccine Appointment. Please ensure you are eligible to book your appointment, because anyone who books an appointment and is not eligible will be turned away when they arrive, just at this time. So just be patient and wait until you're eligible to get your booster. So far, 5,512 boosters have been administered, and we have many more to do. And as a reminder, starting this week, Monday, November 8th, non-citizen, non-immigrant air travelers will need to show proof of full vaccination status, as well as a pre-departure negative coronavirus test taken within 3 days of travel before they can board a plane to the United States. And as I've mentioned at the beginning, we are having to learn how to live with COVID, because it will be with us for a long time, both locally and globally. The ministry is once again reviewing its indicators to determine what metrics can be used to provide as early a warning as possible of future waves of infections. These reviews are carried out on a regular basis, and the current focus on our public health measures is for the purposes of helping all of us to have the ability to sustain a new normal in living with COVID-19. I must emphasize, though, that success in dealing with COVID-19 is a community effort. It is one of the few situations where an individual's decision to adhere to public health measures or not impacts all of us. In this pandemic, individual decisions can have island-wide consequences, as we have seen over and over again. This is not like wearing a helmet or refusing to use your seatbelt. This is much more impactful because, again, it affects each and every one of us. Before I end, I must reiterate that antigen tests do not and will not replace the PCR test that the Ministry of Health uses for diagnostics. The PCR test is the gold standard. If you are experiencing symptoms, you must book a PCR test to be sure. Just this week, someone with symptoms received a negative result on their antigen test and subsequently tested positive once getting a PCR test shortly thereafter. Antigen tests are a rapid screening tool, and a positive antigen result should be followed up immediately with a confirmatory test by a PCR. Antigen tests cannot be used to second-guess public health instructions required to quarantine or isolate. Public health tests are based on the PCR test results or a risk assessment by the Ministry of Health officers. Sadly, we have lost over 100 people to coronavirus-related illnesses. More Bermudians have died to COVID than lives that have been lost in both world wars combined in over a shorter period of time. And as we get prepared for Remembrance Day next week, I hope each and every one of us will think of that. And as such, the Bermuda government will be holding a memorial service next week in memory of those who have passed. This is an opportunity for the entire community to pause and remember those who lost their lives due to this pandemic. And we will provide further details on this memorial event in the coming days. Please remember, we must all do our part to help stop the spread of the coronavirus. Continue to follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. Thank you, and we look forward to having another technical briefing in the coming weeks. Thank you.
Thank you, Minister. Dr. Ayo, I invite you to say a few words.
Thank you very much, Honey. Good evening, Bermuda. I echo the minister's words, especially in giving condolences to people who've lost loved ones to this horrible disease. Tonight, I will be talking to the country around, a couple of issues. Honey, I can't share my screen. Am I able to present my slides?
Okay, give us a second. We'll sort that out just momentarily.
All right. Okay. Yeah, while Honey does that, what I'm hoping to talk about tonight is some of the questions that I have received around the 15 to 11-year-old vaccinations, and also a little bit around some of the new treatments that are emerging so far. And then finally, I would intend to talk a little bit about the booster vaccination program. Okay, I'll try again and see if that works. Okay, yes, it does work. Right. Okay. Right. Okay, I hope we can all see my screen. Okay, yeah, I hope we can all see the screen. So yes, this is what I'll be talking about, the 5 to 11 vaccinations, new treatments, and the booster doses. So you all may be familiar with what the FDA, the announcement the FDA brought out 29th of October, basically authorizing for emergency use of children from 5 through to 11 years of age of the Pfizer-BioNTech COVID-19 vaccine. And this is based on the data following the studies done by the company on over 3,000 children aged between 5 through to 11 who received the vaccine. They were shown to have comparable immune response to individuals 16 to 25, comparable individuals age from 16 through to 25. And in addition, the vaccine was found to be over 90% effective in preventing COVID-19 in children aged between 5 through to 11. So the important thing to note about this vaccination program is that it's similar to what you have for the adults, except that you have a smaller dose, about a third of what the adults will get. So 10 micrograms as compared to 30 micrograms for children in this age group. Apologies, I'm not sure I'm getting this right. I don't think I'm sharing the right screen. Let me try again. Right, I think I have the right screen now. Okay, yes, that's it. And so yesterday, CDC approved the recommendation for pediatric COVID-19 vaccinations for these children. And this is basically based on the realization that COVID-19, particularly the Delta wave that is common, that's most prevalent around the world now, has had a terrible impact on children. In parts of the country, in part of the US, there's been several tenfold increase in number of children being admitted, and that's just had a very terrible impact on children. There's also increased recording for post-COVID syndromes like the multi-systemic inflammatory syndromes, and I think complications such as long COVID, which can have symptoms persisting for months in children. So this is why we're doing what we are doing at the moment. It is unfortunately there's been a tenfold increase in cases in children in the US, and hospitalizations has among adolescents is 10 times higher than in unvaccinated adolescents than in fully vaccinated adolescents in selected states with substantial transmission. So this is why we are advising this the CDC is advising this and supported by the FDA. So what's the situation in Bermuda? Actually, things are similar. We've been very fortunate that we have not had loads of admissions in our pediatric population. However, as you can see from successive waves, things have got worse. So when we had the first, the second wave, this is basically December through to 17th of January of 2021, we had 3 cases, and the subsequent third wave had 60 cases, and the fourth wave had 82 cases, both with 1 admission each in that age group. The 5 to 11 years old, the number of cases increased from 5 through to 54 and almost quadrupled to 180, although fortunately there's been no admissions. For the 12 to 18-year-olds, it increased from 22 to 98 to 139. It's the greatest increase occurs obviously in this 5 to 11-year age band, where we had 10 times increase from second to third wave, and almost 4 times increase from third to fourth wave. That's something that is of concern to us. However, before I move to this, it's important to state that because we are basically get our vaccines from the United Kingdom, from the United Kingdom's government, the memorandum of understanding that we've shared and signed with the UK government compels us to follow the guidance given by MHRA. MHRA has not yet come out with a position statement on this at the moment. At the same time, the Joint Committee on Vaccination and Immunization, JCVI, hasn't come up with their own position. So we're anxiously waiting for that, and we will basically act once we have that guidance. In addition, I would like to talk a little bit about some of the novel new treatments available now for to speed up recovery, basically for COVID-19 patients. It's important to mention that this I've been issued that these treatments are inferior to vaccination because they just help you. First of all, you have to be ill, be infected before you can be entitled to this treatment, and the criteria for people who can get them is quite tight. Furthermore, the improvement in health or the health gain from using this treatment is not anywhere as comparable to what you get from the protection that vaccines offer you. But nevertheless, these are more armaments in our arsenal to be able to fight this pandemic. So we have two new antivirals that have recently been shown promise in treating COVID-19. One is from a company called Merck Sharp and Dohme, and it's shown in clinical trials that it reduces the risk of hospitalizations or deaths for at-risk non-hospitalized adults with mild to moderate COVID-19 by 50%. There's another one from Pfizer that is basically undergoing phase 3 and phase 2 and phase 3 trials at the moment, and is at the moment showing promise. We have assurance from the UK government that Bermuda will be able to access these medications once they are purchased by the UK government. So that's really encouraging news. The other thing that has been in discussions, you probably would have heard about this, is some monoclonal antibodies that is available for treating people who may have been exposed to the virus and are at the early stages of their disease. I must emphasize that these are extremely expensive and not very cost-effective solutions. What monoclonal antibodies are, they're basically lab-made drugs made to mimic the antibodies that your body will produce either to an infection or to vaccination. So something similar to that that is being pumped into your body to give you a chance to fight off this disease. With the right selection, it actually helps to lower progression, reduce risk of death by up to 80% in a select group of patients, but it's not for everybody. That's important that we mention that. Okay, so moving on to talking about the booster vaccines, and this is what the building up on what the minister mentioned. We have had great success in introduction of the booster doses so far. So we can see that almost 40%, or by the end of October, almost 40% of the eligible 70 to 79-year-olds who should have their boosters have already availed themselves of that opportunity. About a third of the 80 plus year group have availed themselves of that opportunity. And as the ministers announced, that we are now opening to 50 years and older, and people who have chronic conditions who will benefit from this. So please make use of the opportunity to register on the website and book a slot to get your booster shots. This is particularly important because we are going into the cooler part of the month, where traditionally in the Northern Hemisphere, we tend to have more viral infections. So most people in the world are expecting us to have more viral infections, including COVID, over the winter months. So give yourself the best protection possible. Linked to that, we are expecting new supplies of vaccines from the UK government next week. So we're in conversations with Government House to arrange for the delivery of a new supply. So we do have adequate supplies to give everybody who needs a booster shot. But echoing what the minister said, please wait for your turn. The best evidence is for older people and for people with chronic conditions, and that's why we're prioritizing them first. So please do wait for your turn before you register for booster shots. Linked to that is a plea for people to get their flu vaccinations if you are eligible for it and if you're offered by your doctor. There is limited evidence to suggest that co-infection with flu and COVID gives you much worse outcomes. So please protect yourself this winter by getting your flu jab when you are offered one, and also get your booster shots for people who've had their vaccines over 6 months ago. And if you've not had your vaccines, please do consider getting that. Talk to a trusted health professional who can answer any questions or queries that you may have. And please protect yourself and avail yourself the protection that the vaccine would offer you. Finally, I would like to emphasize that the outbreak, while our cases are going down, and we're indeed very thankful for that, it's important to emphasize that the outbreak is not yet over. It's still important. We're still finding cases where we don't know the source of the infection. So there is unlinked cases is what we call it in surveillance. And that is basically evidence that there are still, there may still be pockets of infection out there that we don't know about. So this is not the time to give up on the public health measures like washing your hands, wearing a face mask, maintaining physical distancing, and avoiding crowded places. It's important to continue to maintain all those public health actions, even if you're vaccinated, because we still are, unfortunately, in community transmission. And just to echo what the minister said about antigen tests, they are designed for screening. They're not designed to be diagnostic tests. So if you've been exposed to a COVID positive person, or you have any symptoms that are suggestive of COVID, please book a test at the relevant on the government website and avail yourself of the PCR testing that's available on island. And that gives you the confidence to know your true status. So thank you very much. I will now hand over to my colleague, Dr. Wesley Miller from the Bermuda Hospitals Board.
Thank you very much, Dr. Ayo. I certainly echo your words and that of the minister. I'd like to extend condolences to all the families that have lost loved ones, and to encourage those who have not yet had their vaccination and those who are sitting on the fence to go forth and have that, because at this point in time, there are new developments, as Dr. Ayo has pointed out, but none will replace or even match the effectiveness of the current vaccines that we have. Now, I'm pleased to report that in relation to the hospital, we continue to see decreasing numbers, and we're at the stage where the number of discharges outpaced the number of admissions. And I'm also pleased to report that we now have very few COVID patients in the general ward, and also at the present time, we have only a single COVID patient in the ICU, which is a far, far better state than when only a few weeks ago, not only was the ICU full, but we also had to operate 2 satellite ICUs. As a result of these factors, and also the fact that we now have nearly our full complement of staff back in house, because those who were off on COVID precautions or because of exposure or actually having had COVID themselves, they're now fit and back at work. And thus, as of Monday, we were able to offer increased outpatient services in our various outpatient clinics, including wound care, the cardiology clinic, and others. And importantly, we have been able to offer outpatient elective surgery, which so many people have been waiting for. The trend so far is good, and we anticipate not only providing outpatient services next week, but also we will be having some same-day admission, that is inpatient surgery. We still have challenges because now that COVID is on the wane, some of the patients who were hitherto reluctant to come to the hospital have been coming in, so that even this morning there were several patients waiting for bed assignments. We have been able to address that successfully, but what it means is that we will have some limitations initially in terms of the number of same-day admissions which we can do. We will address the backlog, however, as soon as the conditions permit. And here we're assuming that the trend of decrease in COVID will continue. This, of course, presupposes that people will continue to exercise good judgment, social distancing, regular hand washing, and wearing of their mask appropriately. Because if we were simply to take things for granted and resort to things being same old, we could yet see another spike earlier than we expect. And if that were to happen, it would set us back in terms of our plans to ramp up the elective services and to clear the backlog. But assuming that that does not happen, we would be putting on extra sessions so as to address the backlog. Dr. Ayo mentioned the flu season. We're always quite mindful of that. And we would encourage people to go out and also have their flu shots, because if we were to have a bad flu season and several patients in the hospital, that would also put pressure on beds and would set a limit as to how much surgery we're able to perform. And also, contrary to the notion that people have that the flu is simple, no, it can be deadly at times. So where possible, take the necessary preventative measures. That would be our advice. In terms of other matters at BHB, I'm pleased to report that our staff vaccination numbers tend to climb. I remember in the early part of this phase, we were struggling to get beyond 50% with respect to our nurses. Today, I'm happy to report that 85% of the nurses have had at least one dose of the COVID vaccine, and 82% are fully immunized. The doctors were over 90%, and that continues to hold strong. In terms of the BHB staff overall, the picture looks very good, because we were worried that there were several categories who did not take the vaccination serious. They were sitting on the fence. Many had great doubts, but in time they have been convinced by their friends and others, and they have now moved to the situation where overall we have 68% of the BHB staff fully immunized, and another 3% having had one dose. So overall, we have 71% of our staff having either been fully immunized or have one dose. So our numbers are climbing. We always had the confidence that we would get there, though we were getting there slower than we would like. And I must thank the staff and congratulate them for doing the responsible thing. And also at this point, thank the staff members, every single one in all the departments, for the great work that they have done during, before the COVID, and also their willingness to now step up to the next phase to deal with the various issues that we have in terms of providing services after the COVID surge. The question had been asked by some staff members as well as the public, what about the booster? How important it is? There were some staff who were particularly eager to get their booster shots, and I'm pleased to report that they have been able to get their booster shots, and we are encouraging those frontline healthcare workers also to get their booster shot, because they're the staff in the firing line. The uptake so far within the community and the staff seems good. As I walk by the clinic in the late afternoon, the level of activity is pleasing, and I think we're getting there. We certainly appreciate the efforts of everyone. We like the trend, and my last words would be to say to those who have not yet been vaccinated, go out and get your vaccine, because it is still the best option. Thank you very much.
Thank you, Dr. Miller. We will now take questions from the media, and we'll begin with Owain Johnston-Barnes from the Royal Gazette. Owain. There you go. We can see you now, Owain. Thank you.
All right. Good afternoon. Owen Johnson-Barnes with the Royal Gazette. Now, 2 weeks ago, government said healthcare workers would start to receive booster shots in about 4 weeks' time. Obviously, that has been moving a lot faster. Can you say how it's been moving faster? Is this a case where people have been stepping forward much quicker? Or is this a case where people haven't been, and so we're trying to find somewhere else to send those shots?
Hi, Owen. Regrettably, it's a case where people aren't registering as quickly as we would have liked or as was anticipated, because you would have seen the statistics that I read out about the large percentage of the persons over 65. So we are obviously keen to encourage persons to get the booster. And we're just allowing the healthcare professionals who are the frontline persons. In many jurisdictions, they would have been vaccinated, having the opportunity to have the booster as well as the first wave of individuals. So we're just moving quicker through the process because not as many people at this point have taken up the mantle, so to speak, to get the booster. But we're still satisfied. We've done over 5,000 in the last couple of weeks, and as we would anticipate that number will continue to grow.
Now, obviously, the number of active cases in the island has been falling, but there are still people who are dying from this virus. Can we get more details about this, the percentage of people who are dying of this? You've released earlier today the statistics regarding how many were vaccinated, but what are the ages of these people? What sort of pre-existing conditions do they have? And what's being done to protect people with those pre-existing conditions?
Owen, I don't have that data in front of me right now, I'm afraid, but I can say that with respect to, as you've indicated, certain persons that do have pre-existing conditions and then perhaps succumb to COVID as a further complication, that is a sad reality of the situation. However, as we've always indicated, the impact and the effectiveness of the vaccine is critically important, and that it does minimize the risk of persons becoming severely ill and or succumbing to those illnesses. I may have the data in just a minute, if you give me a hot second. The status, and this is up until Saturday, October 30th. Mm-hmm. Those persons that have been fully vaccinated, those persons that are hospitalized and fully vaccinated, the average mean age is 73 and the median age is 77. And hospitalized persons, Owen, that are not fully vaccinated, the average mean age is 61 years and the median age is 62 years. And with
sorry, go on.
Sorry, and with respect to the deaths, the average mean age of persons fully vaccinated is 78. And the median age is 79, and deaths of persons that were not fully vaccinated, the average age is 71, and the median age is 70.
All right. Now, we have still heard some reports from overseas about this Delta Plus variant. Do we have any identified cases of that in Bermuda yet?
I can let the CMO provide further details if necessary, but we did have a meeting this morning, and as you know, we are typing all of the positive cases, and the Delta variant is the variant that is here. The Delta Plus has not been identified yet. All
right. And early on in today's press conference, you mentioned that there are some people who have been getting that first shot and then missing their second appointment. Do we have any reasoning as to why they are missing that second appointment? And can you perhaps get some one of the experts discuss why it's important to get that second jab?
I'll let the CMO explain why it's important, because that's a great question. I want to thank you for that. Asking that. In many cases, unfortunately, persons didn't attend for their second one because of this last wave, and they may have been in quarantine because of being a close contact to someone else. Our numbers, as you've indicated, are trending in the right direction. So we're encouraging those persons that would have missed that appointment due to being in quarantine to go ahead and book their appointment so they can get their second jab. But insofar as the reason why we need to have that second jab, I'll just turn it over to the CMO. Thanks, Owen.
Thank you, Owen. So the original trial, the original phase 3 trials that was done to Pfizer's vaccination in particular suggested to us that the first dose and only 70% of people response.
Dr. Ayo, sorry to interrupt you, we're having problems hearing your audio is off.
Is this any better?
There seems to be talk again?
Is that any better? Can you hear me? Let me try with the headphones.
Thank you. Yeah, there is some static.
Good. I was worried it was just me.
Yeah.
No?
That sounds better. Thank you.
Okay, that's fine. The computer can be a bit temperamental at times, so apologies for that. So what I was explaining, Owen, is that the original trial for Pfizer phase 3 trials with over 40,000 people, almost 45,000 people, suggested to us that after the first dose, 70% of people would mount adequate immune response, and that number rises to 95% with the protection after the second dose. So there's no doubt that having the second dose guarantees that, increases your chances to, as well as good as it can be, have of your protection. And the biology behind this is that we've explained before that the first dose sort of introduces to a person who's never had any infection before, or never. If you give the first dose, what it does is trains the body to recognize parts of the virus, and then the body is able to respond to that. By the second dose, the body is tricked into believing it's being attacked, so it brings an overwhelming force to develop your immunity, and that's why the second dose, in simple terms, it is better for everybody than just having the one dose. So if you've just had one dose, unless there's a clinical reason why you cannot have a second dose, I would strongly encourage you to get your second dose, and that improves your chance of protection from this virus.
Thank you very much.
Thank you, Owen. Our next member of the media will be Earl Basden from Island Stats. Earl, you're on, Earl. Thank you, Earl.
Okay, good afternoon. This question is to the Chief Medical Officer. What advice as the CMO have you given the government in regard to once we reach herd immunity? I must add that the Bermuda public deserve the right to know as the advice given affects everyone once we reach this herd immunity.
Sorry, I was muted. I was talking to myself. Hi, Hel. Thank you for that. Yeah. So I think we have gone over this before. I am primarily a civil servant, and I cannot divulge the information I give to the political leaders, to members of the public. They would they would choose what information that they are willing to share. Having said that, though, I think we are in a different place to where we were at the start of the year. This virus is mutating quite rapidly, so we're not dealing with a single strain of the virus. If we had a fairly stable virus like measles or mumps, then it's easier to get to the point of herd immunity. With a virus that's rapidly changing, the protection you get changes with each mutation of the virus. So the concept of herd immunity is not as relevant in a rapidly changing virus. That's on the one point. The second point is that the original virus that came out of Wuhan, each person who is infected can infect between 2 and 3 people. The variant that we're dealing with now, each person infects 5 to 8 people. So the amount of the proportion of the population you need to cover with when you had 2 or 3 people being infected is obviously different to the proportion of population you need to cover when you have between 5 and 8 people infected. So that's the second point. There's a statistical calculation for that. I won't bore you with that. The third point to mention is our vaccination coverage is not uniform across the country. There are parts of Bermuda that are almost 100% covered, and other parts of Bermuda that we have less than half coverage. So because of this lack of uniformity, you cannot really rely on herd immunity. So those are the 3 factors that I would bring forward to respond to your point.
Maybe the health minister can respond then, because we have been hearing over and over and over about herd immunity when the premier was talking. So Health Minister, any word on what plans the government have if and when we reach this herd immunity? Because you already said it's 69% double vaccinated. So we're 1% away from what the goal was set out at the beginning.
To a different virus, Earl. To a different virus. We're dealing with this Delta strain now. The goal was set to a different virus.
Okay, so where's the goalpost moved to now?
So, Minister, maybe I should let you.
I'm simply going to repeat your answer because you answered the question, Earl. With respect, we are dealing with the Delta variant, which is what the CMO just tried to explain. So everything's been thrown out the window right now because we're dealing with a different variant. And as he rightly indicated, we don't have cross vaccination rates throughout our community. We unfortunately have vaccine deserts, pockets of communities and neighborhoods where the vaccination level is very, very low. Whereas on the other hand, we have areas where they have very, very high vaccination rates. So the scientific rationale behind it was just adequately, properly explained by the CMO. And that's where we are. That's the reality of the situation.
Okay, thank you. Next question for the CMO. Can you advise us why sports athletes and officials need an antigen test, a lateral flow test, negative test, each time they take part in a sport? And if that same person heads out to any other place in the country, they just need to show a safe key.
Earl, sorry.
Yes.
Hi, Earl.
Hi.
The policies surrounding the return to sport, as we've spoken about before, and the initiatives about that can be best addressed to the Minister of Sport, Dr. Peets, who will be glad to answer any of the questions that you have regarding the initiatives and the policies surrounding the return to sports.
I totally understand that, Minister. I'm trying to get a medical opinion on it, or the medical view on it. That's why I'm asking CMO.
Okay, Earl, yeah, the minister has been very clear about this. So these are policy decisions, and you're not going to get a different answer from me. Antigen tests are very, very good in screening people if you have them done sequentially, and if you have a high risk of exposure, perhaps from contact sports or different types of sporting activities, then it's good to have that additional layer of protection, as opposed to where you don't have such close proximity together. And I see your raised brows, and I know that I'm talking in generics terms now. I'm not talking about the specifics. The specifics of sports is what the minister said. That is a policy decision by the Ministry of Youth, Sports and Culture.
Okay, all right. And my final question, I guess, to the CMO how would you convince people that in the sporting community, they are not being discriminated against with all the extra rules for them and not others?
No, I would turn that on his head and say that we're actually trying to protect them, and we're trying to keep the integrity of those sports by making sure we keep the virus out of the sports. That's why we're going a little bit extra. That's why the Ministry of Sport, Youth, Sports and Culture is going a little bit extra to protect the integrity of sports and sporting associations. So I'll turn that on his head. They're not being discriminated. They are actually protecting the integrity of their sports.
Okay. Have a good day.
Thank you. Thank you, Earl.
Earl Basin. And our final questions will come from Gary Foster-Skelton from the Bermuda Broadcasting. Gary. Thank you for joining us, Gary.
Hello there, good afternoon.
Good afternoon.
And let me just make sure, there we are. Can you see me now?
Yes, Gary, we can.
Thank you, ministers. Thank you very much. So my first question for the MHRA in the UK to allow rollout of the vaccine for 5 to 11-year-olds in Bermuda. Can local pediatricians purchase the children's Pfizer vaccine directly from the US for those Bermuda parents who want it as soon as possible? Or would the Ministry of Health not allow that?
Minister, may I? Yeah, okay. Right. So yeah, first of all, Gary, it's unlike most other vaccinations or most other medications. The waiting list to get any vaccine is very, very long. At the moment, it's only been sold to countries, not to individuals. So it would be nigh impossible for pediatricians to lay their hands on this, yes, and to give to their patients if they want, even if that's what they wanted to. But what I would say is to ask people to for a little bit of patience. This is not going to take too long. We will get an answer pretty soon, and we will be able to roll things out once we get the answer. So it's not that easy. It's not like picking up Tylenol on the shelf. It's very, very difficult to get these vaccines, and we've been fortunate to have the supplies that we have in Bermuda. There are still countries in the world that are waiting to get supplies of these vaccines. So doctors' offices can't just order some and get them. It doesn't work like that, Gary.
Okay. Previously, when we got the approval for 12 to 15-year-olds, we were just under a month behind the US, and again that the authorization came from the MHRA. Have you any hints in your conversations with the MHRA that we may be looking at a similar time frame?
No, I can't give you a time frame, unfortunately, Gary. It's what I can tell you is that it's been considered. I don't know the time frame. These are independent bodies. They're not governed by not even the UK government. They're so much less the Bermuda government. So their time frame depends on what the experts in those teams the pace at which they wish to go.
Very well, thank you. Now, we have seen an increase in fully immunized people since the report 2 weeks ago, a 0.5% rise at last week's report, and if I've got the numbers right, followed by almost a full 1% rise in this week's report of the population, easily double the previous few weeks' vaccination rate. But it still sets herd immunity of 87.5%, if that's still relevant, at least 6 months away. It's clear the government's approach is that Bermudians have access to the vaccine, and if there is another outbreak, a return to hard restrictions is unlikely. If there was another wave and strain was once again put on public health and the economy, there has been some commentary in the community that the non-immunized be liable for a greater share of the cost through higher insurance premiums, for example. What is your response to that?
That is a policy question, Gary. I would hand that over to the minister.
Thank you, Gary. Yeah, the CMO is right. Those are discussions that would be held at a policy level. I think that and certainly that would be a matter if the insurance companies chose, for whatever reason, to operationalize that particular initiative that you spoke about. I don't know. I can't speak for the insurance companies. I think it's more important to try to continue our messaging about everybody recognizing that they are effectively their brother's keepers, and that by them taking steps to become immunized, speaking to their doctor if they have concerns about it, et cetera, that just will help the whole community. And whether or not the insurance companies decide that they're going to do something with their premiums or not because of persons being requiring any type of extended treatment and having chosen not to be vaccinated, that's something that I'll leave you to ask them. But certainly we will continue to offer the vaccine for those individuals that wish to have it. There may be some changes that you may see even in private industries insofar as what they may require of their employees concerning immunization status. But those are conversations that are not being held just on the Tuesdays at Cabinet, but also in private boardrooms as well.
As a follow-up to this question, and regarding costs and fees that government itself has control over, you, the government, have vehemently pushed the vaccine as the best way to prevent coronavirus-related illness and death. Following that logic, you must therefore believe that there are Bermudians who died in this past 2 months who would not have died if our eligible population was fully immunized, and that the healthcare and economic strain of the past 2 months would have been far less if our eligible population was fully immunized. If you do believe this, what is your reason for not creating more economic pressure or economic relief to encourage anyone who is eligible to go out and get the jab?
I'm not sure what you mean by economic relief for persons that are eligible. If you're saying pay somebody to get the jab,
well, that does fall under healthcare, but healthcare relief or things like that, insurance relief, or anything that can influence.
Well, you would have known that there were a number of companies that have come forward that were assisting with respect to providing incentives for persons to become vaccinated. I think it does tie, because the government has always indicated that it is a matter of personal choice, and that immunization is something that you should speak to your doctor about. And the hope is that they would make the right choice, but certainly it's a matter of personal choice. And that has always been the position of the government. So I think we would be getting into some fairly ethical issues if we were to go out as a government and say, pay to play, pay to get shot. You know, I think that from an ethics perspective, that would certainly be something that would be somewhat questionable, when on the backhand, we're saying this is something that's a matter of choice. And we're encouraging you to speak to your doctor and so forth and make a proper decision. So if we're offering a choice and then turn around and say, if you have to, we will pay you to do it, that sounds counterintuitive, and certainly it borders on, you know, some kind of ethical impropriety.
Well, thank you. My final question: while the fourth wave of coronavirus infections appears to be petering out, we are still suffering the impact, with several deaths in the last week. The Premier previously told us that this wave was having a worse effect on the Black community. And with that in mind, can you be more specific in the number of hospitalizations and deaths among Black Bermudians, both vaccinated and unvaccinated, and even give us your perspective on why vaccination has been substantially lower, a lower take-up in the Black community?
I don't have that data in front of me, but we have released that data previously insofar as the racial breakdown with respect to the deaths of persons in hospital from the coronavirus. Unfortunately, Gary, there is a historical perspective that I'm sure you appreciate within the Black community as it relates to medical treatment as well as vaccinations. And maybe Dr. Miller would like to share his thoughts about that. And that still is prevalent, unfortunately. And what we are trying to do through education is to encourage persons to speak to their physician about the importance of the vaccination. I mean, the evidence and the science is very, very clear as to the benefits of immunization against the coronavirus. However, as a community, we note that it is largely the Black community and pockets of the Black community that are not immunized, and as well, equally of importance and concern, is it is largely the Black community that are dying from COVID because of their lack of immunization. So again, there is a historical perspective, and again, I'll yield to Dr. Miller, but the reality is we just have to continue beating the drum and continue the messaging and recognize that a number of those deaths could have been prevented had those persons been immunized. And that is certainly a messaging that we need to continue through, you know, these type of mediums to try to drive that message home, because it's a very, very sad reality that we are probably the most underrepresented with respect to immunization and overrepresented with respect to COVID-related deaths. Dr. Miller?
Yes, that's a very good question. In fact, it impacts on sociology, and it also impacts on medical practice and public health. because in this particular case, it was not a question of lack of access or lack of affordability. The vaccine was available free of charge. Access to the various centers was easy. There were mobile centers. There were also individuals who would go into the homes to administer the vaccine. But the education piece was one part of it, because people have various misconceptions about the vaccine. Some of it is spread by Facebook, some of it by a particular radio station, and sadly, some of it by a small minority of practitioners who should know better. And there were competing interests. So, for instance, I went to a fast food place because you learn a lot by walking the streets. And someone pulled me aside and he said, "Doc, you can tell me the truth. I noticed that it must be vaccinated people who are spreading the virus, because we know that they shed viruses." And I had to explain to him that, look, none of the vaccines used nowadays, especially the vaccines for COVID, contain any virus. So you can't be shedding any virus because we're not giving a virus. That may be a hark back to the old days. If we had something like polio, the polio vaccine was a weakened form of the polio virus, to which the individual would develop resistance, and therefore, when exposed to the real virus, they had resistance. So it meant taking the opportunity to sit down in a small shop with them, explaining the difference and the mechanism by which it worked. After that, a few of them promised that they would go to have it done, but it requires that sort of conversation in small groups and really catching individuals when they're ready to talk or when they're receptive. There were also other young people who it took 5 or 6 conversations. And some surprised me that when I thought, okay, there's no way that this individual would be converted, I would be walking out on a Thursday, leaving the hospital, and there would be a familiar voice calling out in the line. And lo and behold, you would see that young person along with the parent in the line for their vaccine. And in fact, there were simple other things that some had fear of needles because they heard stories that it was so painful and they couldn't use the arm. And much of the misinformation led to belief. They had to talk to enough people who said, no, I had it and this was what happened. And then when they believed those ones of their friends. So the information in certain communities, we realized that just by putting it in the newspaper, or if we were to have press conferences or we had lectures on the radio, will not always do it. Even here at the hospital, for instance, one of the things that helped us with the reluctance was when we understood that in the different informal groups, there were individuals who would influence the group. And it didn't necessarily based on any job hierarchy. But if you identify those individuals and manage to convince them, then they're in a better position to pass on that message than even, say, a healthcare worker would be able to do. So because of the different way that people receive their information, it takes much longer. And it is true that the Black community, some of the others would have heard stories of the experiments that took place in the United States and some parts of Europe. And so they genuinely believe that this is a case that they're being experimented on again. So it took enough of us to say, well, look, if it was so, why do you think so many of us as doctors would be lining up to be the first on the 11th of January to make sure that we have it? Why is it that you think we didn't wait even a day? Because we were confident that it was good, that it was the right thing, and we wanted to take the opportunity. So it's an educational process. Some of it is also cultural, because take, for instance, in some parts of the Caribbean, like in Jamaica, for instance, and much of the Caribbean, the uptake is low, notwithstanding the availability of the vaccines. Some of it had to do with the fact that people think, oh, this COVID thing is just like the flu. And in those areas, because traditionally the flu had not been a major problem, they did not push the flu vaccine. So whereas the flu vaccine has been something that people from Europe and the northern parts of the United States are familiar with because they know it's important to have the flu vaccine, many adults, unless they travel, they have not had any vaccines since their childhood. So cultural practices do also influence that. But it is sad because it is indeed in the Black population that we have the lower uptake, and it is in that population that we've had deaths, some of which would have been avoided had they taken the vaccine.
Gary, sorry, excuse me.
Yes.
Thank you, Dr. Miller. I have the data in front of me really quickly. And
Thank
this
you.
is with respect to persons that indicated their race on the registration when they registered. And I'll just ballpark real quickly. Of the persons eligible for vaccination that have not been vaccinated as of yet, and it's about 18,808. In the persons that identified as white, 7,632. Black, 17,021. Asian, 776. Mixed or other races, 3,826. Thank you.
Thank you, Minister. Thank you.
Thank you, Gary, and thank you, everyone. Minister, our time is up. Did you want to have any closing words before we end it?
Thank you, honey. I just wanted to thank the members of the media for their questions, and also Dr. Miller, as well as the Chief Medical Officer, for attending with me today. Again, I want to encourage everyone to get your first and second vaccination dose. Speak to your doctor if you have any questions or concerns about it. The booster program is vaccination and immunizations. Thank you. Good night.